I'm Edmeads, and I am doing experiment-dependent plasticity for my cognitive psychology course. I am describing a time in my life when I have used this practice to change my brain to think that something else is going on. I have had many spinal cord issues, and I have a fusion in my cervical spine. Can't really see the scar, where they took a piece of bone from my hip and they took out the disc and fused the bones together. I had numbness and tingling in my hands, which was horrible. I also have degenerative disc disease, or DJD. I'm not sure if that's what they're calling it now, which basically means that the discs in my spine are slowly but surely wasting away and no longer able to provide the cushion in between the vertebrae. I have had 3 lower spinal surgeries where they went in and scraped the leaking disc material from around the bones, which is medically, they call the surgery a laminectomy, which I'll show you the scar. The first one was in January of 1990, and the second one was in February of the same year, because I fell after the first surgery and did some damage, so they had to go back in. The third time was because there was a bone chip that took its time working its way to the surface, which is why I have 2 belly buttons, one in the front and one in the back. So they had to go in and remove the bone chip that finally worked its way to the surface. I had trouble with major pain and not being able to sit, stand, or lie down for more than 1 to 2 hours. And today is a day that is almost exactly like that. I have a lot of pain in my left hip today. Before I had the neurospinal cord stimulation, I had spinal injections, physical therapy, medications, and everything basically didn't work. When I stopped using them, they stopped working. I'm allergic to most of the basic pain pills, so I am unable to take like the codeine or the Percocet. I also use what they call a TENS unit, which is electrical stimulation on the exterior part of the body. They place pads and they turn on the electrical stim, and it takes the pain away. I also used ice and heat. In 2009, a procedure came in my path which was called neurospinal stimulation, which is like a TENS unit, except it is electrically stimulated from the inside. It involves surgery, and 2 leads are put on either side of the spine and connected to a piece that is placed in my back. I have a remote control, which is here, which I turn on and off and can increase or decrease the amount of stimulation I get. Basically what this does is it tricks my brain into thinking there is no pain. I have what they call positional changes, which means if I lean forward or lean backward, the stimulation can increase. It's pretty interesting, especially when I do it unintentionally. It is like sticking your finger in a socket. That's what I feel basically all the time if the stimulation is high enough. I had to go through a psychological evaluation in order to get approval before the surgery, and Dr. Light at Betty Bacharach Rehab was unsure of whether to approve me for the surgery because of my history with drug and alcohol. However, he decided, after speaking to me, that I would be a good candidate for the surgery. I usually have to have the stimulation adjusted now every 3 to 4 weeks. When I first got it, it worked really well. I went through a period where I didn't think it was working and stopped using it. That was a mistake because the pain increased tenfold. It was horrible. So I went back, I charged it up, and I went and had it readjusted. I usually have to recharge the stimulator in my back for 3 hours for 2 days. It usually lasts, depending on how long I keep it on, about 2 weeks, and then I have to recharge it. I also have to replace the batteries in the remote control. They usually last about 3 months. What is involved in reprogramming the stimulator is I meet with a programmer. I attach the remote control to the computer, and we go through and we change the programs. It takes usually about an hour to 2 hours, depending on how well we get coverage. What we've also learned is sometimes the leads move. We did x-rays to find out that the top of the right lead moved just a little bit. It's curved outward. And due to this, I have stimulation in areas where I don't want it, such as in the chest and rib area. Basically what this means is I will always have this. There is really no way to change it unless I have the stimulation removed, which I was told that that is not a viable option because, as I've realized for myself, the pain gets worse. I am also on medications. I use muscle relaxers 4 times a day, and I use a medication that is for depression that is also used for chronic pain at night. All these things taken together, I am able to function. I am able to move most days without pain. There are some days that I have more pain than others. This is probably going to be for the rest of my life. Before I had this done, my back was so swollen that the doctors wondered how I was even walking. There were days when I couldn't get out of bed, and I couldn't stand up straight. My right leg is shorter than my left leg, which throws my hips out, which also adds to the pain and discomfort. I have been able to trick my brain into thinking that I am not in pain on most days, which is how I am able to walk and to sit and to do all the things that I do. It has also cost me to leave the practice of nursing, which I have been in for 30 years, because I am unable to do the actual patient care due to the pain that is involved. It's one of the reasons why I am in school. Thank you.